Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Hello, listener. As I promised, this podcast episode is about details regarding the various laser platforms and laser technology that is available in the United States for vaginal wellness and urinary wellness, and discuss in more detail what you should know about these specific platforms. Now, there are some platforms that are really dedicated and have a better result for vaginal wellness, and there's some who are better for urinary wellness. I'm not going to include in this podcast episode the electrical muscle stimulation and the electromagnetic stimulation. Those are specifically designated for pelvic floor strengthening. So when I talk about urinary incontinence, which is coming soon, believe me, I am going to talk about those two platforms. But right now, let me start with MonaLisa Touch. It is the first laser technology introduced in the United States. It is a CO2 laser platform. And again, doctors have used CO2 in medicine since 1960s. It has not become widespread until 1980s. It started to become widely used for skin treatments and correction of the fine lines and wrinkles. So aesthetic, lots of aesthetic applications. Lasers were first introduced for vaginal wellness applications in 2014 in the United States. The first laser ever approved by the FDA for use in the United States was MonaLisa Touch. There isn't anymore, but there was some reasonable controversy, first around this laser platform and then the following laser platforms. And a lot of it was, to give it credit, keeping in mind patient safety. However, there was some significant controversy about whether or not this laser was FDA approved for treatment of vaginal atrophy, which is exactly what it was intended to do. So it's possible that the laser sale reps were not very forthcoming as to what exactly FDA approved the laser for. They are better at it today when they talk about it. I don't want to waste your time with details about the doctors who complained against the laser company because they bought a very expensive laser platform, being assured that it's FDA approved for treatment of a certain medical condition. Well, as a doctor, you don't find out that the laser device has been approved from a laser rep. You find out from a conference, a continuing medical education, from a journal, from one of your colleagues that are reading something interesting, then they tell you about it. You find out from somebody who has used the laser and have more information about the laser, right? Maybe you find out from a presentation where the pros and cons and statistical analysis data is going to be presented. You don't take the word of a laser sales rep with no medical qualifications, and based on that, you buy a $200,000 laser. Now, I discussed the purchase in depth with my husband. He advised me to do some due diligence research, and I did. I called two other doctors who had treated women with this laser in the United States. And because I was one of the very first to acquire it in Southern California, I had the laser company arrange a conversation with the doctor that did the initial studies on this laser. And the data and the results were extremely promising. There were no side effects, no complications after the procedure. So obviously, if I cared about women's wellness, especially vaginal and sexual well-being, and I wanted to be a pioneer and champion women's wellness, it was a no-brainer. I bought the laser and I've been very happy with it. Not in the sense of whether or not it brought me a profit or whether or not I've made enough money to cover my investment, but because 100% of women that I treated with a laser received benefits. In my 10 years and plus of using the laser, I bought it in 2015, I have never had a complication, knock on wood. But let me tell you a little bit about how the laser works. Imagine a square opening of about slightly less than a centimeter square. If the laser beam would cover the entire surface, it's just the red beam, right? There would be a completely ablative laser. It would burn the skin on the entire surface of the opening. Now, I did talk, probably in a previous episode. If you didn't listen to it, go back there and listen, about how we do not want to ablate the vagina or burn it off. Even though we can do that to the face, and we can get an amazing result by removing the dead skin and revealing the deeper, smoother layers underneath, promoting collagen and elastin at the same time, we cannot do that to the vagina. We cannot burn off the vagina. Keep in mind, the vagina is a very forgiving organ. It takes a lot of trauma during childbirth. Believe me, it takes quite a traumatic beating. I have seen and repaired thousands of vaginas in my time as an OBGYN. And the amazing thing is the vagina takes it really well and recovers very nicely. However, the risk of scarring and loss of elasticity due to a significant burn is considerable. So obviously, we don't want to burn the vaginal canal. Hence, the introduction of fractional technology. Similar to the face, fractional CO2 laser means that instead of the entire single column being delivered, you have the energy split in tiny beams of columns that cover only 15% of the entire opening. These tiny columns of energy penetrate maximum 200 micron deep. That's 0.2 millimeters. That is important. I'm going to talk about the depth of penetration in a little bit. There are other CO2 lasers on the market that penetrate deeper. But hear me out, as this is not necessarily a good thing when it comes to vaginal tissue quality and to atrophy. So MonaLisa Touch is not deep enough or strong enough to be perceived as anything other than a vibration or a little puff of air, while the probe is in the vaginal canal and the vaginal canal is being treated. We do not do numbing for MonaLisa Touch to treat inside the vaginal canal because there's no need for numbing. It is that mild. We do numb the vaginal opening, the skin at the opening, because it's very sensitive. And performing a treatment with CO2 without numbing on the outside skin of the vagina, which is called the vulva, it's very painful. And there is zero pain when we use a topical compounded numbing cream of BLT, benzoin, lidocaine, tetracaine. So now that I've given you a couple of facts about MonaLisa Touch and what type of laser it is and how deep the energy goes, what type of situations is MonaLisa Touch laser best used for? Well, it was specifically designated to treat vaginal atrophy that occurs with aging. After the studies came out, it was noticed that very mild urinary incontinence was also improved. Some doctors started being innovators and applied the laser to skin conditions on the outside of the vagina, like scarring caused by lichen sclerosus, which is an autoimmune condition that thins the skin, creates the sensation of very dry, very itchy skin. And because the skin, due to this condition, is thin, dry, and inelastic, it splits easily during sexual activity and creates pain, bleeding, and the sensation of burning. Another thing that MonaLisa Touch can be used for, the doctors noticed that treating recurrent vaginal infections that do not respond to anything else or require multiple rounds of antibiotics is very easy and is very effective with MLT, MonaLisa Touch. Last but not least, I've got a few patients, quite a few of them, as a matter of fact, using MonaLisa Touch for interstitial cystitis symptoms to control the frequency, the urgency, and the bladder pain and the painful sex that occurs with interstitial cystitis. Also, after menopause, many women do not necessarily continue to have intercourse, but they have recurrent urinary tract infections. And MonaLisa Touch can help prep and help heal the lining of the vaginal environment, help the microbiome. For some reason, they help prevent urinary tract infections. Now, what does MonaLisa Touch not do? What can we not treat or we shouldn't treat with MonaLisa Touch? Well, first of all, you should never treat or do a treatment if there's an active infection going on. Now, there's some women who have chronic active infections. They're just red and inflamed all the time. You might need to quiet down that inflammation with a little bit of a steroid before we perform the laser, but it's not necessarily mean it's completely contraindicated. Now, what MonaLisa Touch is not useful for is a significant, meaningful tightening, like addressing skin tissue, laxity, loss of sensation with intercourse. We have laser platforms that deliver heat or energy that penetrate deeper and are able to achieve more meaningful tightening, maybe even help conditions like pelvic prolapse. MonaLisa Touch does not address significant stress urinary incontinence. That is leaking when you cough, you sneeze, you jump up and down, you use a trampoline. That is caused by your bladder neck descent, caused by the loss of tightness and pelvic floor weakening, which is due to aging and mainly trauma during childbirth. So let me move on and talk about laser platforms that would be useful for vaginal laxity and improve sexual function and help pelvic prolapse and stress urinary incontinence. So there are 2 reasons for vaginal laxity. Number 1 is childbirth trauma, having a baby in a vaginal manner. The risk of incontinence and significant laxity after a vaginal childbirth could be as high as 30, in some studies 50%. And the number 2 reason for vaginal laxity is aging. And when we age, we suffer a loss of tissue quality due to the loss of estrogen after menopause. And B, we lose muscle strength and suffer pelvic floor weakness due to aging. Now, any technology platform that would meaningfully improve vaginal laxity requires delivery of energy, specifically heat, to the deeper layers beyond the surface of the vaginal skin in order to allow shrinking of the tissue, tightening, and lifting. There are platforms that provide ablative energy, some at close to 1 millimeter depth, 0.8 millimeters. But again, there is a risk of scarring if we deliver energy strong enough to go that deep and injuring the vagina at the same time, the vaginal surface, with vaginal platforms intended to rejuvenate the vaginal skin, make it thicker, moist, and elastic. The key is to be gentle as far as tightening and lifting and addressing vaginal laxity and the loss of sensation, because we want the tissues to be good quality. But when we talk about, again, the tightening, the lifting, the vaginal laxity, the loss of sensation, urinary incontinence, the key is to deliver energy to the deeper tissues, but sparing the surface of the vagina. The key is the depth. And to achieve a meaningful tightening and lifting, we need 4 to 6 millimeters to get the results. And I will discuss this in detail for each laser as I go along, but we need 4 to 6 millimeter depth for that energy to target the layers that actually need to tighten and lift. Okay? So let me talk about radio frequency platforms. They've been around for a long time. They deliver gentle energy, heating the tissues to about 42 Celsius. That is enough to remodel the current collagen that is in that area and promote new collagen and new elastin formation. Most radio frequency platforms you might have heard of. The first one that was introduced in the United States was Thermiva. It's been around for a long time. The Cynosure's version of it was called Vitalia. The difference between the two, Cynosure equipped their vaginal probe with a sensor for temperature that gave a constant reading of the temperature of the tissues. And for all radiofrequency treatments, we require 5 minutes at the optimal temperature. The little thermistor at the tip of the Vitalia probe wouldn't count the time that the temperature dropped below 39 Celsius, allowing the woman who used Vitalia versus Thermiva to undergo a much more efficient treatment. Now, here's the thing with radiofrequency. Radiofrequency delivery requires that the operator, the person performing the procedure, moves the probe constantly from place to place within a certain zone. So it's kind of like a hot stone massage, right? You might have had radiofrequency for your face, and it's the same for the vaginal canal. You need to make sure that you come back and forth and maintain the heat throughout the targeted zone of treatment. Obviously, some basic skill is required. And when this treatment is done vaginally, ideally, you should have either an OBGYN do it or someone that is trained by an OBGYN. Why? Well, honestly, no one knows the anatomy better than an OBGYN or a mid-level provider trained by an OBGYN. It is a weakness and a limitation of the use of this platform. If you have listened to this episode and think to yourself, wait a minute, I had a Thermiva or something similar with another office, maybe a nurse practitioner did it, maybe it was a med spa. I didn't get the results I thought I was going to get. Well, that's probably because performing the treatment requires some skill and understanding of the pelvic floor anatomy, an evaluation of the severity of the vaginal laxity before and after the treatment. And number 2, because women are sold 3-session packages 2 to 4 weeks apart with the promise that they will feel an improvement that's going to last. Sometimes it takes 5 sessions, sometimes 6, sometimes 7. It depends on the patient's age, the quality of the tissues, her ability to respond, and it depends on how severe the condition is. Also, what is not explained in a manner that is clear to the patient is that once the treatment is done, and you do notice, okay, well, I got results. I got a little tightening of the tissue. There's an improvement in my sexual function. I'm tighter down there. My ability to experience sexual satisfaction has improved. What's not being told is that you need to keep it up. Every woman knows that if they want their face to look good, they need to apply skincare treatments daily. They need to go have a facial regularly and periodically, once or twice a year, do some form of laser treatment, right? Ladies, it is the same thing down there. Just like you go to a med spa to get a facial or an injectable to help your appearance or get a laser treatment for your face, find a medical spa for your vaginal health. I think I've made the argument of why we need to take care of our vaginas earlier in the previous podcast episode. So please find a vaginal med spa, what I like to call a vagina gym. Sign up, get a membership. I offer one, and then keep up with the treatments. Okay, quick, short detour. Let me get back to the laser platforms. Let me talk about a very valuable platform that delivers radio frequency and cryo energy at the same time. This is a very unique platform called VAVIV. It is a unique energy delivery platform designated and designed for women's health. Radio frequency platform operated with cryo tanks. First and foremost, what is different is that the vaginal probe, remember I told you with the radio frequency, you have to keep moving it and back and forth, so you can't keep it steady in one point, it would burn the tissue. Well, with VAVIV, the vaginal probe is applied to the tissue. Same thing, we need a gel to make contact, but you keep it steady while the energy is being delivered. Again, you cannot do that with a regular radio frequency because you burn the patient. So you have to constantly move it within a target zone. You make your target zone too large, you move too far away too fast, and the zone you heated earlier will lose the temperature. It won't stay above 39 Celsius long enough for meaningful results. The patient thinks she's getting a treatment. It takes 5 minutes, right? Like I said, it requires a little bit more skill and understanding of what you need to achieve and how you need to achieve it. Because VAVIV delivers cryo energy first. It will cool the tissues to the point where when the RF energy gets delivered, the patient is able to tolerate the heat in that specific area very well, as long as there's enough gel to make contact between the probe and the tissue. During the VAVIV treatment, there's a total of either 250 or 350 pulses that are being delivered. And because the vaginal tip of the probe, which comes loaded with 250 or 350, will deliver cryo first and then RF, radio frequency, it takes about 2 to 4 seconds for each pulse to be delivered. So it's a pretty lengthy treatment. It's about 45 minutes. There's absolutely zero numbing required. The beauty with the VAVIV technology is that by being static in its delivery and by employing 2 different technologies, cooling the tissue and then heating them, allows the energy to penetrate more than the 1 to 2 millimeters typical for the RF platforms. VAVIV claims that they are able to deliver energy deeper, 5 millimeters. Obviously, this will much more meaningfully impact the new collagen production, tighten and lift the vaginal tissues significantly, alleviating the symptoms of urinary leakage and vaginal laxity, while also improving moisture at the same time. Now, here's the bad news. The company went bankrupt in the US a few years ago. It still operates in Canada, Australia, and throughout Europe, but who the heck knows for how long? What bankrupted the company was likely their decision to get FDA approval for urinary incontinence, which was going to make them really big in the vaginal laser market. No laser platform has ever attempted to get FDA approval for any medical indication. Again, there is no FDA approval for a specific medical condition for any of the laser platforms that operate or are available in the United States for vaginal or urinary health. The FDA approval is for specific tissue effects, like electrocoagulation, heating of the tissue, and that is the same for all the platforms. Vitalia, Thermiva, MonaLisa Touch, FemiLift, Diva, whatever, you name it. None of them have approval for treating a specific medical condition. Now, they have approval on what the laser does to the tissues. How the doctors use the platform is their decision. That's why the doctors need to take the information, the appearance of the tissue, the functionality, the desired effect, and make a decision and discuss with the patient, counsel them, and give them options, right? The benefit of VAVIV, as opposed to most technology platforms employed for vaginal health, Every single platform needs to deliver a series of treatment sessions every month, 3 to 5 months in a row. The benefit of VAVIV is requires a single treatment, not a series of treatments. The collagen remodeling and the new collagen formation require 4 to 8 weeks to happen. The woman usually notices an improvement in the urinary health and her ability to control the bladder leakage, the urgency and the frequency, suddenly in circumstances where there was a guaranteed leak before. And it happens right past about 4 to 6 weeks mark. That is why, because it's a single treatment, the cost of VAVIV is higher than any other treatment on the market right now because it only requires one treatment. Okay? Now, if you add all the other packages for all the sessions you need with the other treatments, they come up to be equal. Now, is this a one and done? Well, not even surgery is a one and done. And that is unfortunately true for many, many women. Why would a laser technology that builds upon your own collagen and elastin be a one and done? Your body will continue to weaken as you age and will continue to lose collagen and elastin. You will need to do another treatment, sometimes at 18 months, sometimes at 24 months, sometimes at 3 years, depending on the age of the patient and how fast their collagen deteriorates. Again, unfortunately, nothing lasts forever because we continue to change as we advance in age and we continue to deteriorate. Now, I'm not about spreading doom and gloom, but what I'm about is the fact that you need to understand that aging is inevitable. Changes due to aging are inevitable. However, you can put up a good fight with a doctor that understands the situation on your side, in your team. And if you understand the mechanism of the lasers and what they exactly do for your body, you're much more likely to make a good choice for you, okay? Some women choose surgery because they're looking for that magic pill, the magic bullet. It's going to get them fast to the kingdom of milk and honey, which for vaginal and urinary wellness is being strong, in control of your bladder, desiring and enjoying intimacy with your partner without pain or fear of consequences like a urinary tract infection. However, what many women fail to understand when they decide to have surgery is that surgery will not address or improve the quality of their tissues. Only 2 things do that: hormones, estrogen, or laser technology. There is no magic vitamin that can be used to rejuvenate our vaginal and urinary tissues. Sure, you can use some hyaluronic acid for vaginal dryness. Very expensive. It lasts a few hours. It's not a solution. There is no magic medicine that's going to make your body healthier and protect you from leakage of urine, from urinary tract infections, from recurrent vaginal infections or vaginal pain with intercourse. No magic medicine. But laser can be that magic technology that helps with all these things. This was a short parenthesis. Let me keep going and continue discussing the laser platforms, what they specifically do, allowing you to be more knowledgeable and aware and hopefully make a better decision when time comes to decide, hey, do I need a laser down there and what kind? And ask the right questions, right? Now, I'd like to say a few words about microneedling the vagina. And you're like, what? Well, I remember the day when the rep for the laser technology dropped the pamphlet by my office. My staff told me, hey, doc, the rep dropped this off for you to read and he would like to set up a meeting. I replied, microneedling the vagina. I said, ouch, that sounds painful. As it turns out, it's not painful. I'll tell you more about it, but let me continue this little tiny story. I have a very curious and adventurous nature, even though my age held me back. I was like, okay, I don't want to add another technology. What is this? I have so many vaginal lasers. What is it about? I wanted to meet with a rep eventually. So I sat down, I found out about the technology, and mainly the reason I decided to buy it and give it a try is because of the depth that the energy was going to be delivered. I still had VAVIV, but VAVIV was on its way out. So I decided to approach Morpheus V right after VAVIV because, number one, they're related. They both generate radio frequency, but in very different manners, okay? Now, when the needles get deployed with Morpheus V, and then the radio frequency energy gets delivered at the tip of the needle, it's deeper than the 2 millimeters that normal radio frequency is delivered at, okay? We're able to deliver the energy deeper, so there's more significant tightening and lifting of the vaginal walls. Obviously, as I said before, the deeper the energy gets delivered, the more likely we are to obtain the outcome of bladder control and significant improvement in vaginal laxity, allowing for improvement in sexual function as well. Remember, I told you MonaLisa Touch penetrates to a depth of 0.2 2 millimeter. I told you that the radio frequency energy gets delivered to about 1 to 2 millimeters depth. VAVIV gets the energy delivered as deep as 5 to 6 millimeters, and Morpheus V can deliver energy as deep as 5 millimeters. The Morpheus V does not damage the vaginal wall surface with heat. It has to penetrate the vaginal walls with the needles to deliver the energy, but the needles are insulated at the surface, protecting the surface. Now, what's interesting is no one has ever done a study head-to-head. You have your selection criteria, people who leak urine, let's say, after 3 deliveries. You establish everybody has to match it. You randomly assign a patient to Morpheus, the other one to VAVIV, and then see which one works better. Well, you would need someone with both platforms. You would need the company to still produce the materials needed for VAVIV. Apparently, the company that makes Morpheus V actually acquired VAVIV, but only they're distressed that they're not planning to reuse the technology. So that point of trying to go head to head and compare which one is better, it's a moot point. And it's kind of the same with every single laser technology out there. Like comparing MonaLisa Touch with Diva or FemiLift. Nobody wants to buy 2 platforms in the same technology and start playing around and seeing which one is better. Okay, these things are too expensive. Again, unfortunately, it's probably one of the main reasons why the maker of VAVIV went bankrupt in the United States, trying to do a study to prove that you get improvement clinically. So the FDA says, yay, green light, all urinary incontinent women, go get this laser. That's not going to happen, right? The company went bankrupt in the US 2 years ago, I think. Actually, 3 years ago. It still operates. But again, what bankrupted the company was their decision to get FDA approval for urinary incontinence. So let me talk for a minute about that. There is no FDA approval for a specific medical condition for any of the laser platforms that operate and are available in the US for vaginal wellness. FDA does not grant approval on how the doctors use the platform. It grants approval on the type of energy delivered and the tissue effect that the technology claims and proves it can produce. Whether that translates into improvement in sexual function, whether that translates into better control of a woman's bladder, whether that translates into, let's say, improved appearance of a woman's outer vagina or a man's penis size and function, all of these desirable outcomes have to be proven in a form and a method that is so expensive, so difficult, and lengthy time-wise. We're talking about possibly decades, right? None of these companies want to pursue any form of FDA approval for any specific outcome. Again, it's a moot point. More so, let's say the technology is FDA approved for a specific indication, maybe a medical indication like urinary incontinence, or erectile dysfunction, right? Or painful sex after menopause. Then technically Medicare will have to cover it. And then the PPOs will have to cover it. And the cost of the treatment, time, and consumables involved is not cheap on top of the platform itself. But whatever that would be, it will be way below the actual cost that the doctors are now charging. It is a lose-lose situation. The company that launches the technology will lose a ton of money trying to seek FDA approval. Then the doctors that buy the laser platform will lose a ton of money because the insurance will not pay the cost that the doctors want to charge to cover the cost of the equipment, their training, their time spent in doing the treatment, and the consumables. You could argue that many more clients would make up for the lower cost as more women and more men would like to have laser treatments to improve urinary control and sexual function if they're covered by the insurance company. But then the doctor will have to perform the treatment, not charge the cost up front, wait months to be reimbursed, and then have to send the patient the bill, and the patient might still say, well, if my insurance doesn't cover, I don't want to pay. It happens more often than you think. So again, this is a lose-lose situation. For both the laser company and the doctors who buy the laser technology, I do not foresee a future where such technology will actually be covered by insurance companies. Okay? So after this short little tidbit of information about why I personally believe lasers will never get covered, and I'm sorry if I dashed your hopes about that, let me get back to some of the other laser platforms. I actually have one more, Photona. But before I do that, let me finish with Morpheus V. Remember, I said I was worried it was going to be painful for my patients? Well, before I went forward, I actually asked the rep to arrange a clinical demo on people that I trusted, and I asked for volunteers from my own staff. I had 2 volunteers, very intelligent, educated women who gave me very honest, good feedback on the fact that the procedure was not painful. We do numbing. However, the procedure was more uncomfortable after than they thought it was going to be. Remember, there's going to be minuscule puncture wounds into the skin, and it's most likely the downtime is worse if we treat the outer vaginal tissues for the sake of improving their appearance, wanting to tighten and make them look fresh and younger, less so inside the vaginal canal. So long story short, this procedure with the Morpheus V does take a little bit of skill as well, because when you treat the vaginal canal, you have to make good contact. So you have to understand you need to apply pressure. So the tip of the probe, when the needles get deployed, they deploy directly into the tissue. Otherwise, there's going to be an arcing effect where the loss of contact creates significant discomfort because the energy is deployed very close to the surface instead of deeper beyond the surface, okay? The needles that are deployed into the tissue usually get deployed at 3 millimeters, 2 millimeters, 1 millimeters. There's going to be a deeper effect. So if the needles get deployed to 3 millimeters, the heat will likely go 4 or 5, maybe 5 at the most. And during the treatment, there will be multiple passes in the same session. So the vaginal canal gets treated at the 1 millimeter, the 2 millimeter, and then the 3 millimeter depth. Now, this procedure does require, again, numbing with a very specific concentration of lidocaine and tetracaine, compounded by a specific pharmacy, and applied hopefully by someone with some understanding of the pelvic anatomy and the vaginal canal, and gently wiped off before the procedure. There is a recommended downtime of about 7 days after Morpheus V treatments, no tampons, no intercourse, maybe up to 14 days, depending on the age of the patient. Again, the energy deployed once the needles are activated can be customized to a lower energy for women who are older and have more significant atrophy and thinning, or a normal to a higher energy for younger patients who have no atrophy, whose tissues are younger, thicker, moist, and who suffer from urinary incontinence and would like to avoid surgery. So one more laser, and I'm done. I left Fotona for the end because Fotona is a unique platform. It has the capability of delivering something called a smooth mode pulse and is using an erbium YAG laser. What is unique about the smooth mode is the delivery of energy below the surface without impacting the surface of the vaginal wall. Okay? So to quote from the Fotona website, their unique smooth mode delivers patented sequential erbium YAG smooth mode laser pulses to the vaginal wall mucosa, generating controlled and optimal distribution of heat within the tissue, enabling collagen remodeling and new collagen formation. The 2940 wavelength, in conjunction with the patented smooth mode delivery, allows for a highly controlled, safe procedure with no impact to any critical structures, and there are quite a few around the vagina, the bladder, the rectum, and that includes any penetration or disruption of the mucosal lining. The G-Runner, which Fotona provides an automatic delivery of the laser energy to the vaginal canal by using a very precise microprocessor-controlled positioning system to provide consistent, safe, fast, and uniform delivery of the smooth laser pulses along each position of the vaginal wall. So basically, the procedure involves the use of a glass speculum that is introduced into the vaginal canal, and then the probe that delivers the energy is threaded through the threads of the glass speculum, and the foot pedal activates the probe rotation. So the probe rotates in a predetermined manner and it delivers the pulses. All you have to do is position it at the entrance and push the advance button, and then push the pedal, and the probe does the job. Okay? So it's highly controlled and automatized. Now, the photothermal heat wave reach up to 0.5 millimeters below the vaginal mucosa. So that's not that deep, right? However, the collagen fibers get shorter and thicker because of the heat-induced collagen remodeling, and because we keep delivering heat on top of heat, sparing the mucosa, this laser delivers multiple passes, not just one pass. It's not a one and done. So the deeper tissue layers get pulled up and tightened by the remodeled superficial tissue layer. Remember earlier I spoke about delivering the energy to the deeper tissues? Well, the beauty about Fotona is that it delivers the energy at 0.5 millimeter depth. However, during the same treatment, we have multiple passes to deliver the energy with a cumulative effect. And again, the number of passes is highly customizable depending on the severity of the patient's circumstances. Someone with severe laxity and significant prolapse will need to have 5 to 7, maybe 9 to 10 passes within one treatment session. It does take time, and there's no numbing required for the vaginal canal. The energy delivered needs to dissipate from the glass speculum within the tissues. We have to take 30 seconds breaks, maybe sometimes even longer, to allow the speculum and the tissue surface to remain cool and for the heat to keep going deeper. So it's very interesting technology that, again, delivers energy without any impact to the surface, allowing remodeling of the deeper tissues. And this is what we want when we're looking to improve functionality, vaginal laxity, sensitivity, etc. Now, if you've never heard about Fotona, it's known for its Fotona 4D proprietary treatment combination. It has been made famous by the Kardashians, who tried and loved the Fotona treatments. It's a colorblind laser in the sense that it's safe even for darker skin or skin that is prone to hyperpigmentation. And just like it lifts and remodels the face, it's going to do the same to the outer vaginal skin, significantly improving the appearance and giving a woman the cosmetic results without any need for a dramatic labioplasty. Now, I'm running out of time. I talk a lot about vaginal laser platforms. There's tons of them out there. I really wanted to touch bases on the ones that I have in the practice that I'm very familiar with. And I didn't want to dish on anybody else's parade or rain on their parade and say that other lasers are not as good as mine. But I like to talk about what I know best. And this is why I picked the lasers that I have in the practice right now, because I was pretty sure that they're the best in class. And I know them by heart. I know very well how they operate and what they do. So in case you have to make a decision, okay, which laser is for me? Which do I get? What is the best thing? Well, come and sit down and have a consultation. Someone that has one laser will only market that laser and will tell you that laser can deliver the results that you're looking for, even though it might not be the best technology for you. I'm not going to tell you this laser or that laser or the other laser is better. Sometimes we start with a package and we start with a technology, and I can shift mid-treatment to another technology if you're not responding, because I have the capability of doing so. So stay tuned for my podcast episode about urinary leakage, and where I would draw the parallel, and I'll talk a little bit about surgery and about non-surgical treatments. And I want to dedicate time about lasers that do help urinary incontinence. So come back for that episode, and I will close here, and hopefully you learn some information that made you, wow, I didn't know that that's possible. I didn't know that that could be done. And you thought all we have for vaginal wellness are medication, pessaries, gels, and surgery. We have more. And it's time for us to be honest and talk about all these laser platforms, because they're here to stay and they're very effective and they deliver what they promise. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas. So please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.